Welcome to this edition of AFMC.
I'll tell you how I got better. I'm
Glad to be here.
But a mission to
Delivery of
improve.
I think that we're going to talk about everybody's.
Arkansas is the second highest prescriber.
Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Dr. Bradley Bibb. He is CEO and owner of Access Medical Clinic that's in over 8 states and with over 40 of those clinics here in Arkansas. And he's also president-elect of the Arkansas Medical Society. Dr. Bibb, thanks so much for being here.
Thank you for having me.
So tell us what the most important thing the Medical Society has done for you as a physician in Arkansas.
Well, that's a tough one. So, I think from my point of view, the Medical Society is very important for advocating for physicians and our patients in the legislature. So whether there's things that can be enacted to help improve, our patients' care or our jobs as physicians, or whether there's things that we feel like could be harm patient care, that we have to, deal with those things. So I think the most important function from my point of view is that the Medical Society advocates for physicians for those political issues, and physicians aren't historically don't do those things, and so to have an organization that helps do that is very valuable to us.
And it's important for AMS for the future of medical students and residents here in Arkansas as well.
Yes, I think that when you're a medical student or a resident, you're focused on your education and preparing for a career. So it's very hard to be involved in policy discussions and legislation and things like that when you're, in training. And so, but these things are continually, or things coming up, or things that are issues need to be addressed. And so these are things that are going to affect students and residents for the next 30 or 40 years. So it's important, I think, for people to know about the Medical Society when they're in those stages of their career, but also know that it's hard for them to commit the time to really do those things outside of the Medical Society. So my first experience with the Medical Society was as a freshman medical student, several years ago at UAMS, and so that's kind of where I began my journey with the Arkansas Medical Society.
And when you think about 150 years, it's a long time to be celebrating AMS this year. What comes to mind as some of the pivotal things that the society has done for healthcare in Arkansas?
Well, it's tough. It's really kind of awesome to me that the society's been around that long. That's one of the oldest entities in the state of Arkansas. And so I'm not a historian. I know that the Medical Society's been involved in a lot of things for several years. So just in my time, last 25 years, the Medical Society, I know when I was starting practice and coming out of residency, any willing provider was a big deal. So it dramatically affected how physicians interact with insurance companies and networks. And so that was something that, just off the top of my head, that I can think that was a huge impact for physicians and kind of my tenure as a member.
And you touched on this a little bit. How does this Medical Society advocate for physicians and healthcare providers? Like, what are some of the specific challenges that are addressed through this advocacy?
Well, the biggest challenge is time. I think physicians are busy taking care of patients. They take call, and then having the time to spend on meeting legislators, being at the Capitol. That's the biggest challenge. But I think the society helps with that. But we have lobbyists that work for us, that know our issues. The Medical Society helps us kind of identify our legislators and help us, meet with them and advocate for our issues.
And you also touched a little bit about the future of healthcare. Why is the Medical Society so crucial to that future?
Because it's the clinician voice on what goes on in the state. I mean, healthcare is highly regulated, as you know. It's regulated a lot on the state level, especially, and on the state level more so than even federal. Things are local, And so, having the medical society, have the time, our team at the society, to help research all the issues and help educate us. I think, and then that helps bring a physician voice to the issues. And so, legislators, who some of them are, good friends of ours, some of them, we have to negotiate with, but it's good though to hear our point of view. I mean, we don't always win everything, and people don't always see our point of view, but I think it's important, since, we have the training, years of our life taking care of people, to at least people understand our point of view on some of these issues. And so I think that the medical society is really good to help get that point of view across, so it can be, with all the other factors that go into play, the legislators at least, have that as something to at least listen to.
And what are the key priorities for the medical society moving forward?
That's an ever-changing thing. And so I think that from year to year, there are different issues. There are issues that come up that we don't even expect. Some legislator might have an idea on something that could really help us or hurt us. And so, year in and year out, that changes. And I think, but without getting into specifics, going down a list of bills, I would say that, our overriding goal is to advocate for things that improve healthcare, improve our patients' life, and, improve the job situation of the physician, so that they have good work-life balance, and that, so anyway, so I did basically just promoting the health of the state of Arkansas is so whatever comes up in the legislature, we look at it through that lens, and we advocate for things to meet those goals.
So shifting gears a little bit, what message would you like to share with healthcare professionals and the general public about the importance of supporting the medical society?
Well, I think it's simple. I mean, from my point of view, supporting the Arkansas Medical Society is supporting healthcare for Arkansans. That's how I see it.
And in close, is there anything else you'd like to add that the medical society or the state of healthcare, what do you want Arkansans to know that we haven't mentioned, and how pivotal AMS is?
Well, I think that, there's lots of noise in the healthcare world now. Used to, there wasn't Google, and there wasn't all these other things where everybody, they come to the physician office knowing what they want. And so that's a struggle, but we have to change with the times and understand that, and, work with the culture and society that's to help them, we want, our overriding goal is to make people healthier or help them become healthier. And whatever we can do to do that is our goal. And the medical society's goal is to help physicians achieve that goal with their patients.
And the 150 years is something to be proud of, and seeing the change in how this medical society has shaped healthcare in our state for physicians. What is the lasting message, the takeaway message that you want for our audience to hear about those 150 years and in the gala that's happening in May?
Yeah, well, we're excited. Like I said earlier, it's pretty awesome to be part of an organization that's been around 150 years. With that comes responsibility, because I need to do everything I can to help, keep it on this path of success. And so, being the 150 year, it's an honor for me to be president on the 150 year anniversary. I didn't know that was going to happen. I learned that afterwards. And so I think we're going to have a much larger gala than we normally do. And we hope that we'll have lots of guests and some people who really care about healthcare in Arkansas show up for that.
Well, Dr. Bibb, thank you so much for joining us today and sharing your knowledge. And the future is bright for the Medical Society. Thanks so much for being here.
Thank you very much. I appreciate it.
And that's it for this episode of AFMC TV. Thanks for watching, and have a great day.